Welcome to today's video, Diabetic Feet, warning signs you need to know now. Imagine losing the ability to walk, to stand, to live independently, all because of something you could have prevented. Today we're talking about a silent threat that can steal your mobility, your feet. If you have diabetes, this video isn't just important, it's life-saving. Taking care of your feet when you have diabetes is not just about comfort, it's about preserving your independence and overall health. Welcome back to the channel. Today we're tackling a critical topic, diabetic feet warning signs you need to know now. For millions of people living with diabetes, foot complications aren't just a possibility, they're a very real and serious risk. We're going to learn the critical diabetic feet warning signs you need to know now to prevent serious complications and amputations. These aren't just abstract medical facts. These are real-world indicators that your body is sending you, signals that demand your attention. Ignoring them can lead down a path of chronic pain, infection, and in severe cases, loss of a limb. As a diabetic, it's essential to be aware of the potential foot problems that can arise due to nerve damage and poor blood flow. Two common accomplices of this condition. From numbness and tingling that might seem innocuous at first, to more alarming signs like ulcers that refuse to heal or dramatic changes in skin discoloration. We'll cover the top warning signs you should never, ever ignore. Our goal isn't to scare you, but to empower you with the information you need to take proactive steps. Take control of your diabetes management and protect your feet for a healthier, more active and fulfilling tomorrow. Let's get started. One of the earliest and often most subtle warning signs your body might send if you have diabetes is the sensation of numbness or tingling in your feet. This seemingly minor annoyance can be the first whisper of diabetic neuropathy, a type of nerve damage that is a common complication of diabetes. This sensation, often described as pins and needles prickling or even a burning feeling, shouldn't be taken lightly. It's a crucial signal that your nerves, particularly the long ones reaching your extremities like your feet, are being affected by high blood sugar levels over time. When these nerves are damaged, their ability to transmit signals to your brain is impaired. This means you might not feel pain, temperature, or touch as acutely as you normally would. This lack of sensation might sound like a minor issue, but it carries significant risks. It's incredibly important not to dismiss persistent numbness or tingling. If you find yourself frequently experiencing these feelings, or if the sensation doesn't go away quickly with movement, it's a clear indicator that you need to discuss this with your doctor. Early intervention can help manage symptoms and slow the progression of nerve damage. The real danger with numbness, the hallmark of advanced neuropathy, is that it can mask injuries. Imagine stepping on a small, sharp object, getting a blister from a new pair of shoes, or even developing a small cut and not feeling it at all. Without the warning signal of pain, these minor injuries can go unnoticed and untreated. For someone with diabetes, an unnoticed injury can quickly become infected, especially if blood sugar levels are not well controlled. If you're experiencing any degree of numbness, tingling, burning, or unusual sensations in your feet, it's absolutely crucial to schedule an appointment with your healthcare provider or a podiatrist. Early detection and management are key to preventing the cascade of problems that can start with this seemingly simple symptom. Another important set of warning signs your feet might display involves changes in their skin color. Your skin is a remarkable organ, and its appearance can tell us a lot about what's happening underneath, especially concerning circulation and inflammation. If you have diabetes, paying close attention to the color of the skin on your feet and ankles is a crucial part of your self-care routine. One common color change to watch for is redness. If an area of your foot appears unusually red, warm to the touch, and possibly swollen, this could signal inflammation or an infection, such as cellulitis. Conversely, your foot or parts of it might appear unusually pale or white. This pallor can be a sign of poor blood flow, a condition known as peripheral artery disease, PAD. Perhaps the most alarming color change is a bluish or purplish hue known as cyanosis. This indicates a severe lack of oxygen in the tissues and is a critical sign of severely compromised blood flow. If you notice your toes or a larger area of your foot turning blue or purple, this is a medical emergency. These changes in skin color are often rooted in the damage diabetes can inflict on your blood vessels. High blood sugar levels over time can make blood vessels less flexible and more prone to narrowing and blockages. It's a good practice to compare your feet. Does one foot look different in color from the other? Are there specific patches of discoloration? Make it a habit to inspect your feet daily in good lighting. If you observe any persistent or concerning changes in the color of the skin on your feet, contact your doctor or podiatrist right away. Early diagnosis and treatment of circulation problems or infections can prevent more severe outcomes and protect your limb health. Swelling in your feet or ankles, medically known as edema, is another significant warning sign that individuals with diabetes should never ignore. While it's true that standing or sitting for long periods or even hot weather can cause some temporary swelling in anyone, persistent or unusual swelling in a person with diabetes can indicate more serious underlying issues. For people with diabetes, swelling in the feet can arise from several diabetes-related complications. Poor circulation, a common issue, can lead to fluid accumulating in the lower extremities. Kidney disease, another potential complication of diabetes, can also cause generalized fluid retention. Furthermore, inflammation due to an undetected injury or infection can also manifest as localized swelling. One particularly severe, though less common, cause of dramatic swelling, redness and warmth in the foot of a diabetic patient is Charcot foot. Another critical condition that can cause swelling, typically in one leg or foot, is deep vein thrombosis, DVT. When you notice swelling, pay attention to specific characteristics. Is it in one foot or both? If it's in both, it might suggest a systemic issue like heart or kidney problems. If it's primarily in one foot, it could point to a local issue like an infection, injury, Charcot foot, or DVT. If you experience new, persistent, or worsening swelling in your feet or ankles, it's essential to consult your doctor. Proper diagnosis is key to effective treatment. Remember, your feet are trying to tell you something with that puffiness. Listen carefully and act accordingly. All right, let's move on to a truly critical warning sign that demands immediate attention. We're talking about sores, cuts, blisters, or even those seemingly minor issues like ingrown toenails that just won't heal or are healing extremely slowly. For someone living with diabetes, a non-healing wound on the foot isn't just a nuisance. It's a major red flag for potentially severe complications, including deep infections and, in the worst-case scenario, amputation. So why is healing so often impaired in individuals with diabetes? There are several interconnected reasons. Firstly, peripheral neuropathy can mean you don't even feel the initial injury. Secondly, peripheral artery disease, or PAD, can reduce blood flow to the feet, depriving the wound of the oxygen, nutrients, and infection-fighting cells it needs to heal properly. Thirdly, high blood glucose levels directly interfere with the healing process. This trifecta of neuropathy, poor circulation, and the systemic effects of high glucose makes any break in the skin on a diabetic foot a serious concern. The types of wounds we're talking about can vary. It could be a small blister that you thought would resolve on its own, but instead gets larger or starts to weep. It might be a cut from trimming your toenails that just doesn't seem to scab over and close. Or, most dangerously, it could be a diabetic foot ulcer, an open sore that can develop often on the sole of the foot or on pressure points. If you discover any break in the skin, no matter how small or seemingly insignificant, that isn't showing clear signs of healing within a day or two, or if it looks infected, contact your doctor or podiatrist immediately. Hot or cold, what your foot's temperature tells you. Another subtle yet important clue your feet can provide about your health, especially if you have diabetes, is a noticeable change in their temperature. Specifically, we're looking for discrepancies. Is one foot or part of one foot significantly warmer or colder to the touch than the other foot, or compared to the rest of your body? If you notice that one of your feet or a specific area of one foot feels unusually warm or hot compared to the other, this can be a sign of inflammation or infection. Conversely, if one foot or both feet consistently feel cold to the touch, this can be a strong indicator of poor circulation, likely due to peripheral artery disease, PAD. The best way to check for temperature changes is to use the back of your hand. which is more sensitive to temperature than your palm. Gently touch one foot, then the other, comparing them. Then compare the temperature of your feet to your calves or thighs. Do this in a room with a relatively stable temperature. It's important to establish what feels normal for your feet so you can more easily recognize when something is off. Consistency in your self-checks is key to detecting subtle changes early. If you have neuropathy, you might not feel these temperature changes yourself, making it even more important for you or a caregiver to perform these tactile checks regularly. Any persistent or significant difference in temperature between your feet or a foot that is consistently much hotter or colder than usual for you should be reported to your healthcare provider or podiatrist. Don't dismiss these temperature signals. They are valuable pieces of information in the ongoing effort to protect your foot health. Shifting shapes when foot deformities signal danger. Over time, diabetes can lead to changes in the actual shape and structure of your feet. These foot deformities, while sometimes developing gradually and painlessly, especially if neuropathy is present, can significantly increase your risk of developing serious problems like calluses, blisters, and ultimately diabetic foot ulcers. Recognizing these structural changes early and taking steps to accommodate them is crucial for preventing pressure-related injuries. Some common foot deformities that can be exacerbated by or are more problematic in people with diabetes include bunions, hammer toes, and claw toes. Another very serious deformity is Charcot foot, where bones can fracture and collapse, leading to a rocker bottom shape or other significant distortions of the foot's architecture. Diabetic neuropathy plays a major role in these deformities. Nerve damage can affect the motor nerves that control the small muscles within your foot. When these muscles weaken or become imbalanced, they can no longer hold the toes and bones in their proper alignment. The primary problem with these foot deformities is that they create abnormal pressure points and areas of increased friction when you wear shoes and walk. These constant, concentrated points of pressure or friction can lead to the formation of thick calluses. This is where the importance of proper footwear and potentially orthotic devices comes into sharp focus. If you notice any changes in the shape of your feet, or if you have existing deformities like bunions or hammer toes, it's essential to see a podiatrist regularly. Proactive management of foot deformities is a key strategy in ulcer prevention. Small problems, big dangers, ingrown toenails, and fungal infections. Finally, let's talk about two conditions that might seem like minor annoyances to many people but can escalate into serious problems for individuals with diabetes. Ingrown toenails and fungal infections of the skin or nails. An ingrown toenail occurs when the edge or corner of a toenail, most commonly on the big toe, grows into the soft flesh surrounding it. This can be caused by improper nail trimming, wearing shoes that are too tight, or even just the natural shape of your nail. For someone with diabetes, an ingrown toenail is more than just painful. It creates a break in the skin, providing an entry point for bacteria and leading to infection. Proper nail care is therefore essential. When trimming your toenails, cut them straight across, not too short, and gently file any sharp edges. If you have difficulty reaching your feet, have poor eyesight, or have thickened or very curved nails, it's much safer to have your toenails trimmed regularly by a podiatrist or a trained foot care nurse. Fungal infections are also common foot problems that pose an increased risk for diabetics. Athlete's foot is a fungal infection of the skin, often starting between the toes, causing itching, redness, scaling, and sometimes blisters or cracked skin. Fungal nail infections can cause nails to become thickened, discolored, brittle, and crumbly. If you notice any signs of an ingrown toenail or a fungal infection, seek prompt treatment from your doctor or podiatrist. Vigilance against these seemingly small foes is a big part of diabetic foot care. Your feet, your foundation, taking action for a healthier tomorrow. Your feet are your foundation. They carry you through life, and protecting them, especially when you have diabetes, is absolutely paramount. We've covered 7 critical warning signs today, from numbness and skin changes to non-healing sores and deformities. Recognizing these signs early and seeking prompt medical attention can make all the difference in preventing serious complications. If you've experienced any of these warning signs yourself, or if you have a story or a tip about diabetic foot care that could help someone else in our community, please take a moment to leave a comment below. Your experience is valuable and could offer support or insight to others navigating similar challenges. Also, be sure to check out other videos on diabetes management for more tips and advice on staying healthy and effectively managing your condition. And if you found this video helpful, if it provided you with actionable information or a new perspective, please give it a big thumbs up. It really helps the channel reach more people who need to hear this message. Knowledge is the first step towards better health, and by sharing this, you're helping to spread that vital awareness. And most importantly, if you haven't already, don't forget to subscribe to the channel and click that notification bell so you don't miss out on more vital health information. Our mission here is to empower your journey to a healthier tomorrow, providing you with credible, understandable, and actionable advice. Taking care of your diabetic feet is a daily commitment, but it's one that pays huge dividends in terms of your mobility, independence, and overall well-being. Thank you for watching. Stay informed, stay healthy.